We're going to discuss something now that a lot of women experience but often feel embarrassed to talk about: incontinence. Dr. Marjorie Dixon is here with what we need to know about prevention and treatment. We've talked about it before. We will talk about it again. Dr. Dixon, it's good to see you.
Good to see you too.
Let's start with, what is incontinence?
It's involuntary loss of urine. So you know how you go around and you go to a washroom and decide to let down and pee?
Yeah.
It's not happening that way.
It doesn't happen that way.
It dribbles, it leaks from little bits to like a whole bunch.
A whole gush.
Yeah, a whole gush and like disaster. So,
Okay.
And you have no control over it.
Yeah.
And there are different types of incontinence. So there's the, you know, when people say, I laughed so hard I peed my pants.
Yes.
Yeah. That's called stress urinary incontinence. So
Okay.
it's when you like jump on a trampoline or go for a run, exercise, cough, sneeze, that stuff.
Yeah.
Stress urinary incontinence. Then there's the incontinence that's called urge urinary incontinence.
Okay.
And that's the, you go shopping, you come home, you put the key in the door, run for the bathroom.
This is mine.
Yeah, or else
That's my brand.
Okay, that's urge. And so those are the two most common types.
Okay.
There's also like overflow, so for men with prostate issues, for example,
Yeah.
so they never really fully empty the bladder, so it backs up and then it leaks.
Got it.
There is functional, so if medical illnesses, Alzheimer's, Parkinson's, diabetes, anything that might innervate the bladder, interfere with that, that's called functional. And then there are mixed types, so it can be a variety, a mixed bag of that stuff.
Okay, very interesting. And women are apparently more susceptible. We're at higher risk
Yeah,
for
why?
this.
Yeah.
Why?
Estrogen.
Come on.
Estrogen, man. We love estrogen. I like when it runs out, I'm going to rub out my butt.
Right?
But estrogen,
Where do I buy that stuff?
I know. You have to put it in the right spot, too. So
Right,
the estrogen,
okay.
when menopause happens,
Yeah.
actually it's as prevalent as 50% of women over the age of 50
Okay.
have a degree of incontinence. Yeah, so that's that. And then it's also anatomically, because
Yeah.
in women, our bladder sits right under our uterus, where the
Right.
babies grow. So, you know, when you have a baby,
Yeah.
your uterus is pushing on the bladder, so that's something that happens in pregnancy. And then after you've pushed through the muscles of your pelvic floor to push the baby out of the vagina,
Yeah.
that too can impact the support system for your bladder, because that musculature sits from your pubic bone all the way to your tailbone.
So you just blow out the pelvic floor with the vaginal birth. It's like how you start losing your estrogen, where you have all of the things at the perfect storm.
It's a perfect storm.
So you say 50% of women might have incontinence in some form, but it's not okay.
Yeah, like
This is interesting, because I always thought it was just something you deal with.
Yeah, I know, and this is the thing that I feel like I deprogram a lot, where
Yeah.
women will see me as a fertility specialist and they've had one baby and they're like, yeah, so I'm leaking, I want to get it fixed. I'm like, oh, you have the rest of your babies, because you'll keep destroying your pelvic floor,
Yeah.
and then we'll deal with it after.
If someone is watching right now and thinking they might have this, but they aren't sure, what signs should they be looking for?
Well, if you're leaking any urine, you need to understand what kind of urinary incontinence. Remember I said they're the two main types, the stress and the urge, and that needs to be diagnosed. And then sometimes your bladder becomes irritable because you have an infection. So you might have a low-lying urinary infection. So you have to see a healthcare professional that will work through that. So they can do a urine dip test looking for white blood cells for signs of infection.
Okay.
You can do a urodynamic study, which actually sees how you pee.
Okay.
So you go there, you drink,
Yeah.
you empty your bladder, and then they check a residual urine to see how much is left over, if anything's left over, and it helps to diagnose the type of it.
Huh.
Yeah.
Okay.
And then they also
I hope they're
put
not
it-
watching you. I'd have performance anxiety.
You still do it in the background, and then you come
good.
back. But then they actually put a thing in to see how much urine you have left over. It's fun.
Wow.
I know. We did
Okay.
it for fun in medical school. Okay, that. So then the other thing
That's a
you
whole
can
other
do.
story.
Yeah, you can also get a cystoscopy. So they put a camera
Okay.
into the bladder and they see if there's any other reason why you might be losing your urine that's not the traditional, not some worrisome stuff, because sometimes
Yeah.
you can have a bladder tumor or things that can irritate the bladder internally. And then there's also cystograms, so they see the functionality of the bladder. They're all the way from the kidneys to the bladder to the urethra where the pee comes out.
Wow. Okay, there's so many things they
lots.
can test and do.
Yeah.
What can be done at home? Any prevention tips for us?
Yeah, so prevention tips or management tips until you get to where you can get to. So if you're leaking urine, you don't have to change your pants all the time. There are
Yeah.
undergarments to manage it, so that
Totally.
to catch the urine, that's one.
Yes.
You can also do for stress urine incontinence, actually for both stress and urge initially, you do your Kegel exercises, and they're exercises where, remember I talked about the musculature of the pelvic floor, so you can actually work out the muscles of your pelvic floor, so you do them now.
I'm doing them now.
Are you doing? But
it's just that I give up because it's like now I'm bored, or I forget about it. It's like it's been 30 seconds.
You gotta
I'm done.
keep it up. You start with your elevator in the basement, and then you lift it to the first floor.
I don't have
you
good
lift
control.
it to the second floor.
Oh boy!
Don't let it drop though. Then you let it down little by little.
Okay.
And then you can kind of
I
feel
just let
like
it down.
All right. You can't do that though, Tracy. You got to keep the urine in.
Okay, I got to keep the urine in. All right.
So you can do that, and then you can cut out the things that irritate your bladder.
Like?
And they're all the good stuff. Alcohol, caffeine, chocolate, red wine, spicy food.
Come on.
Yeah, menopause comes like death and taxes, right? And you can't even make it better by eating the stuff that makes you happy.
Let me tell you something. The only thing that's great about having the kids do all the extracurriculars is I can't drink anymore. I'm always driving a car.
So there you go.
So there you go.
There you
so
go.
that
No
should help in some way this situation.
Yeah.
So thank you for all that info. And yes, go ahead.
Healthy lifestyle, right? So
Healthy
keep your weight
lifestyle.
low. If you have a chronic cough, get it fixed. Like all the things that can irritate, increase your intra-abdominal pressure, which pushes on your bladder, fix that stuff.
Very good, Dr. Dixon. Thank you. You always have very helpful information.